There's a lot of doctors who are leaving healthcare, good doctors that are leaving healthcare. We've got prices that are keep going up, and we can guess as to what it might be, but there's a lot of misunderstanding with that. So today's guest is Dr. Deane Waldman. He's going to clarify a lot of this for us. Dr. Waldman, thanks for joining us today.
It's my great pleasure. And yes, there's a lot of confusion going on and a lot of, quite frankly, misinformation. And if we clear that up, I think people will have at least a better understanding. Doctors and nurses are tolerating this system and are still working in it, not to mention the patients. I'll give you a perfect example. Imagine you're working for a company. The company's name happens to be healthcare, but you're making a product that everybody wants and everybody needs: food, air. Everybody needs it sooner or later. And so you join this company that does all this great work, you think, and you go to work. Only on the way into work, you got all these reporters shoving microphones in your face saying, "Did you steal dollars? Did you fraudulently take money from healthcare, from the patients?" You get in through the front door of your office, healthcare office, and there are patients there throwing rocks at you, and they have guns, and they're angry at you. You don't know why they're angry at you, but they're angry at you. You finally get through all that, and you get to your workstation, and you try and turn on your computer, only there are about a half an hour worth of security codes that you got to get through in order to try and do your work. And oh, by the way, they changed all the codes yesterday, so now you got to do a whole new different process. And then you start to do your work, making air or making food, or in our case, trying to care for patients. Only the organization, the business you work for, makes it harder for you to actually do what they hired you to do. And oh, by the way, that salary they promised you, no, they only give you a fraction of it, and they say, take it or leave it. Well, that's what nurses every day and doctors every day have to put up with. And so, one of the things we got to do in this conversation, especially for your audience, is to say, okay, let's not do what we usually do and play the blame game. I'm not interested in saying, pointing the finger at somebody. What's wrong with the system itself, and how the hell can we fix that? Because that's what we need to do. So we need to focus on why the system doesn't work for patients or doctors or nurses, and what do we do to make that work for the patients and the doctors and nurses. And that's what this book that you referred to earlier on, Become an Empowered Patient. That's the name of the book. It's also available in Spanish if you like Spanish. Sé un paciente empoderado. And that's what we need to talk about: how patients can actually get the care they need when they need it without going broke.
Yeah, because you've made a really, really powerful statement. You've said that the U.S. healthcare has cancer. And that again, that's a super powerful statement. So, what exactly do you mean by that?
I've used that analogy a lot of times, and people sort of, they do this and they go, yeah, actually. All right. The cancer, a cancer is a normal cell that gets out of control and starts taking all the energy out of the system and not doing what it's supposed to do, and eventually it kills the patient. Okay. What's the cancer in healthcare? The answer is one word: bureaucracy. For example, last year we spent just a shade under 5 trillion, repeat, $1 trillion on healthcare, okay? More than half of that did not go to a doctor, a nurse, a hospital, a pharmacy, a hospice, a healthcare center, a person who makes wheelchairs. It went to bureaucracy. In other words, that whole regulatory apparatus and, quite frankly, the whole insurance process and profit all steal money from patient care. And so when I say there is a cancer What I mean is that cancer, and we all need a bureaucracy. There is a certain level of organization that has to take place of any complex organization. Somebody's got to order the pencils, and somebody's got to get the lights turned on, and so forth. Okay, that's a job for overhead bureaucracy, call it whatever you like. But when the bureaucracy starts telling the doctor what they can and cannot do for the patient, then suddenly the bureaucracy has become a cancer. When it takes the money that should be provided for patient care and takes it for itself, that's cancer. And so that's what's going on right now. And I like to call us, we the patients, obviously in honor of our founding fathers, we the people, but also to remind us that everybody, I don't care what your political persuasion or your skin color or who your grandfather was or what your religious persuasion is, sooner or later, you're going to need health care. And so I like to call us we the patients because together we need to and can fix healthcare.
Yeah, it's this kind of leads me to ask you really about the rise in the cost of healthcare, and is this part of the bureaucracy and everything? Because we pay extra money, and then we think and we hope I'm going to get extra care, but it just
And,
doesn't seem like that. Is this a
and it's
design flaw?
yes, that's exactly. And the recent healthcare insurance unaffordability or the insurance affordability crisis, a perfect example of that. Namely, we are not asked, we are forced to pay more money in premiums, in copays, in deductibles. Now, I won't say that's okay, but for the moment, let's say that's okay. And what do we get for it? We, the patients, get nothing. Wait a minute. So think about a normal process of you're going to buy a car, okay? And this guy's got a price of $20,000 for a car. This guy's got a price of $40,000 for a car. And then there's a 30,000 thrown in there somewhere. Well, you look around and you go, well, what can I afford? Well, I like the 40, but I can't afford that. So I'm going to go with the either the 20 or the 30. Nope, that's not the way it works. And they don't compete. The insurance companies don't compete the way the car manufacturers do. They are not sensitive to our affordability, our meaning we, the patients. They just raise their rates and say, hey, go pay it. Well, the reason they can get away with that is because there's a third party payer system. There's somebody in between who takes our money, we the patients, takes our money and gives it to the insurance companies. And the insurance companies can say, okay, we want more money. And the employers have to do it. 84 million Americans, no, that's not true. 84 million American workers and their families are covered by employer sponsored health insurance benefit. Everybody who works for a large organization has that benefit. Well, that benefit is actually theft. By that I mean that benefit came from a World War II. I'm a World War II baby, so we're talking about literally when I was born, they passed a wage freeze because we were in the midst of World War II. Well, to deal with that wage freeze, they gave employers this advantage, namely, they could give their employees the health insurance without raising their wages. Okay, all these wage freezes were repealed at the end of World War II, except one: the tax advantaged employer sponsored health insurance benefit. So, for the last 84 years, okay, American workers have been denied a certain amount of wages that they earned. Last year, that amount was $26,993. So let's start with I always used to say to my people, if you suggest a problem, you got to offer me a solution. Here's my solution, right? Repeal the employer sponsored which it isn't employer sponsored, repeal the employer sponsored health insurance benefit, and give 84 million American workers and their families the money they all earned, namely $27,000. Put it in an HSA and let them deal with health insurance, shop for care, all those kinds of things, and get the third party out, get the bureaucracy out of the system. I know that sounds ridiculously simple, but the trouble is, it is ridiculously simple by taking this complex machine that we've got and get it down to where it's supposed to be, which is one doctor and one patient together with nobody in between them.
This kind of sounds like that healthcare system where they're trying to make all these, I'll call them fixes. Let's fix it. You're at a mechanic. But then the fixes, the patchwork just makes it worse, it seems like.
You are so right. When I went to business school, I learned something really kind of interesting. When we practice medicine on a patient, we never look at just one structure or one system. By that I mean, I'm a pediatric cardiologist. I don't look at the heart and think about treating the heart like a rhythm problem. I'm going to give them a drug without thinking about how that drug might affect the kidney or the liver or the brain or something else. So you have to think about the system as an integrated system. In healthcare, what they've been doing for the last, well, basically ever since Medicare and Medicaid, 1965, is they've been piling Band-Aids on top of Band-Aids on top of Band-Aids without ever saying, well, why doesn't it work? What's the root cause, or in our case, etiology? Well, the thing I learned in business school was a thing called systems thinking. And what systems thinking is basically the exact same thing as practicing medicine, which is you never look at one part of a system. You have to look at how the parts interact. And that's so you have to say to yourself, how does, for example, you talked about fixes. How does this regulation that they just passed make it easier for a patient to see a doctor? If the answer is it does, well, great. Except show me one single fix. The Affordable Care Act. Okay, the Affordable Care Act gave a lot of people expanded Medicaid enormously. Okay, sounds like a great idea, except for the minor problem, and we say this in the book repeatedly: insurance doesn't equal care. So what they did was they gave people, lots of people, insurance, but the insurance was worthless because the doctors couldn't afford to take care of more Medicaid patients because they lose money on every Medicaid patient. So the money that was used to prop up the Affordable Care Act, and I'll tell you how I know this directly, the money, $1.76 trillion, went to pay for the bureaucracy for the Affordable Care Act. Two things. One, I was a director of the New Mexico Health Insurance Exchange. How did that come to be? Answer: the Affordable Care Act created another bureaucracy. I was part of it. I tried to direct money to patients, and I, quite frankly, failed a lot of time. Okay, number two, President Obama took $716 billion, repeat, billion dollars out of the Medicare trust to pay for the Affordable Care Act. Well, wait a minute. Care is going to go broke, insolvent between 34 and 2036. Why? Because there ain't enough money to pay for senior care. So what happens when they run out of money? Seniors aren't going to get hospital care. Well, wait a minute. The Affordable Care Act was supposed to help people. All the care you deserve. Well, guess what? The regulation, just as you said, Chuck, the regulation sounds good when you just hear it, sort of a little sound bite. But as soon as you start saying, okay, Does this help the patient get care? The answer is, well, actually, it makes it harder for the patient to get care. So, what we are saying repeatedly, by the way, I have to tell you about this book because it's really kind of important. I figured out what's wrong with healthcare. I mean, I did a lot of study and I used a lot of the tools I have from business school and so forth. I figured out what's wrong, but I couldn't figure out how to make it right. I met this guy named Dr. Vance Ginn. He actually had been the chief economist for the Office of Management and Budget in Washington. So not only was he a brilliant economist, he also knew the inner workings of the system. And he and I sort of taught me what legislation has to be repealed, what legislation has to be changed, how to make the money flow into patients' hands rather than insurance company hands. And all of this is in the book. And what we are trying to do is to get people to think about the fact that they need to control their own money. And when they do that, they control their own health care. And suddenly the system will work.
You're talking about the bureaucracy. We're talking about band-aids and things like that. Just my comment on this, I liken that to automobile tabs. We just stick the tab on top of the tab, next. Pretty soon it's so thick, and they were thinking, oh, I got to peel it off and get to the bottom to start over. It's flakes off. So it's kind of like the same thing. Is gets to the point where it's so difficult to get back to the beginning to fix it. You've got all these flakes, so you've got all these broken
Okay, but
pieces.
let me add your to your simile. It's not just tag on top of tag, but each tag weighs 50 pounds. And so suddenly your car doesn't run as smoothly because it's too damn much weight on the car.
Does all of this that we're talking about so far lead to the fact that a lot of good healthcare professionals are leaving the profession because of
Okay,
frustration and and everything else?
we write about this too, and it's obviously a very sensitive subject, but I need to explain it. I did a study years ago about why so many doctors and nurses interviewed over 1,200 people in one healthcare system. Why they're so dissatisfied. Believe it or not, money didn't even enter the. I mean, people said, yeah, I want to make more money. That's not the reason people go into healthcare. Sure as hell is not the reason nurses go into healthcare. They know they're not going to get rich being a nurse. The reason we do what we do, the reason I get up at 2 o'clock in the morning for some critically ill baby, is what's known as the psychic reward. By that I mean we do something good for some sick person and we feel better about ourselves. It validates our existence. It's if you study psychology, there's Maslow's pyramid of human needs, and the highest pyramid is top of the pyramid is called self-actualization. Is where you actually are the best version of yourself and feel that you have worth, have value to yourself, to society, to your family. Okay, that's why we get up in the morning. Well, when you have a system like we do now, where the government says to me, no, you can't operate on that baby at that hospital. And not only can you not operate at that hospital, you have to operate on this hospital because that's where we have the contract, but you can't do the surgery. He's got to do the surgery because we've got a contract with him and he's cheaper. Or, oh, you want to give him drug X? I'm sorry. You've got to do fail first therapy, which is now common in all pharmacies and all pharmacy managers, which is you got to use the safest, cheapest, least effective drug first. It has to fail with that patient. Then you go to the next tier. Well, wait a minute. I just want to give the patient the best drug for that patient for that condition. Nope, sorry, doc. So back to psychic reward. So suddenly the nurse and the doctor is no longer actually using our judgment and our experience and our knowledge of that patient to care and get good care for their patient and to get the psychic reward. Instead, we are denied the psychic reward. And so that's why nurses, there are 200, the last time I checked, 56,000 empty nurses slots. Quarter of a million. There are just over a million doctors in the entire country, and we're losing them. And the rate at which we're losing them increases, and it increase. And I'm sorry, you think AI is going to substitute for my judgment with a critically ill baby? I'm sorry, no. And an AI ain't going to operate on that child with a hole in his heart. It's going to take a human with years and years of experience and training. And unless we change the system, we're going to end up with people who are going to be standing in line, dying, waiting for care. And that's already beginning to happen in this country.
I'm understanding more and more about, like I said, the psyche, the gratification, the satisfaction of being a doctor or a nurse or a healthcare professional, and how difficult it is. But I also think now, though, that we, the people, make it difficult for the doctors too. Because I'm likening this to a wheel, but not a smooth one, a cog with all these little kinks all around. People are supposed to be happy. They're supposed to be satisfied and pleased with the service they get. And then if they aren't, because of the bureaucracy, not because of the healthcare professional, they put
Yeah.
pressure on the doctors as well,
Yep.
which then in turn makes it 2 or 3
Yep.
times more difficult and worse for those healthcare professionals.
I'm sorry to say you are dead on. That's actually true. We get blamed when there's a bad outcome, even though we did everything right. We get blamed because they wait for. Last time I looked, and this was several years ago, at the emergency room at the university hospital that I worked at for a long time, 11-hour wait. Well, who do they blame for waiting 11 hours in the emergency room? They don't blame the system, they blame the nurse who's supposed to admit them, and they're angry at the nurse. Well, lady, I'm doing the best I can, but I can't. For example, the ER is a good example of systems thinking. The reason there was so much of a delay in getting people out of the ER were the people who were really sick who needed to get into the hospital. They didn't have beds because they didn't have nurses. So the hospital upstairs is saying, oh, yeah, we want to take this heart attack patient, but the ICU is full and we don't have any more nurses. So you're going to have to wait until we bring in a traveler or somebody else as an extra and find a bed somewhere. Well, in other words, again, systems thinking. You can't just look at the ER and say, well, the problem is the ER. The problem is the way the system parts work or don't work. And when they don't work, that's why you get uh, um, wh- why is it so expensive? Well, we're back to money again. Everybody's talking about affordability. As a doctor, I sit here and I think to myself, imagine how much care I could give patients if somebody gave me another $2.5 trillion to pay for care, because that's the amount of money last year that went to the healthcare bureaucracy, the regulatory apparatus, the insurance process, which is very complex. That whole pre authorization thing, we shouldn't have pre authorization. If the doctor thinks you need a hernia repair, you shouldn't get an insurance agent's approval or delay or deny or disapproval. You need a hernia repair before the damn thing incarcerates? Well, then let's get you into the OR tomorrow and we'll fix it. Nope, it's not the way it works. Become an empowered patient. It's very important to understand that the patients can't sit around hoping or wanting or even expecting Washington to fix this, because Washington, to fix it, they have to give up power. They're not going to
Mhm.
do that unless we, the patients, 84 million Americans, have to say, hey, I want that $27,000. I earned it. Okay? I want it, and I want to put it in an HSA, and I want to control my money. And I want to go shop for whatever doctor I want. I don't want to have the doctor that the health plan says I have to have, or it takes me 6 months to get my hernia repair, or etc. Unless we do that, we take control. And then we're talking about at the ballot box. I'm not talking about a revolution here. I'm talking about we, the patients, demand these things that are in the book be, and that's why the title was very important. Become
Hmm.
and empowered. We have to empower ourselves. We do not have to, we can't hope and ask for federal politicians to be nice and give up the money that all of their henchmen bureaucrats are getting and let us have our money. We have to demand it.
This may sound off topic, but this makes me want to say, when you have the opportunity, get out and vote. You make you can
That's
make a
that is
difference.
not off topic. That is so on topic. We have to stop looking for somebody else, an expert, me, to fix healthcare. We, the patients, have to say, I understand. I need my medical freedom, which I have been denied ever since third party payment, because medical freedom means I choose my care. That's legally protected, and yet it is the insurance company that chooses your care, not you and not the doctor. So, back to your statement about the ballot box. We have to take charge. It's one of the things on the website empowerpatients.info is there's a whole section called Take Charge, and it says here's what you need to do. You need to talk to your legislator. You need to learn how to shop for a doctor or a hospital or drugs. I'll tell you this, I just learned this. My daughter showed me this, I think it was TikTok. There is a pharmacy here in Texas, there are probably others, but one that she pointed out, that is a cash only pharmacy. Okay. Now, there are cash only practices. It's called direct primary care. There are four of these surgical centers that are cash only, which I'll tell you a story in a second because it's a really great story about a U.S. veteran. But this pharmacy is cash only. Well, guess what? That drug that normally costs you $25 a pill, a pharmacy made a deal directly with the manufacturer, no middlemen in between. And the pharmacy is offering you that $25 pill for 99 cents.
I should be coughing, not because I've got a dry throat. I should be coughing because this is crazy. This is crazy stuff. I mean, like I
When you
said,
look about it, when you think about it, just logically and say, what's the purpose of the system and all that kind of stuff, it's crazy. You're absolutely right. It's like this is a system designed not to give care to people. And the whole we're supposed to save money? No, that's not the purpose of the system. We're supposed to create job. The number one job creator for the last several years in the United States have been healthcare jobs. And so they tout this, well, isn't this wonderful? Excuse me, those healthcare jobs were bureaucratic jobs. They weren't doctors and nurses. So more and more money is going away from patient care to overhead bureaucracy, corporate profit. The process should be damn simple. The doctor talks to the patient tells the doctor what's wrong, they decide on a treatment plan, the doctor hands the patient a bill, the patient takes some money out of their HSA and pays the doctor. That's the system. That was the system back when I was a child, and that's the system that everybody in my family's been doctors for literally the last four generations. That's the system that my grandfather, my father, four uncles all worked under which was a direct connection between the patient and the doctor. And that's what we need to get back to.
I'm not only am I glad that we're having this conversation about people and then the people becoming empowered about all this, but I'm glad we're having this conversation because, again, I'm going to go back to we, the people, always had put the blame on the healthcare providers, and that's who we always pointed the finger at. And I'm glad we're doing this because there's that clarification of it's not your doctor, it's not your nurse, it's not your healthcare provider that is doing this to you. It's the bureaucracy.
Well, I'll go one step further, which is, and they also blame the insurance company. Now,
Mm-hmm.
let me talk a little bit in defense of them. The insurance company is there not to be a care provider. The insurance company is there to make money. It's a profit making enterprise. It has to make profit or it literally goes broke, closes its doors. What is insurance supposed to do? The answer is it's supposed to deal with financial risk, not medical risk, financial risk. And so if you want to point a blame finger, and I don't, but if you want to point a blame finger, it's back to the regulatory apparatus, the game rules in which the insurance company plays. Now, let's just change the rules a little bit and say, hey, no more insurance regulations. You insurance company people have to sell your policies to we the people. And by the way, you better price them in a way that the people want to A, buy them, and B, can afford them, or you won't sell any. It's called the free market. So again, we're back to these 84 million American families that have 27 more $1,000 in an HSA, and they say, okay, I want high deductible catastrophic insurance. I'll pay for the rest of my care. The routine stuff, my kids' vaccinations, and even a hernia repair, whatever. I can afford that out of 27K. I want a high deductible. I want junk insurance, what they call junk. It's short term insurance because I'm changing jobs and in between I need some insurance. Fine. Right now, you can't buy it. But if we had a free market and people had money, the insurance companies would have to play the game by our rules, not by federal rules. And suddenly they'd be competing for lower prices for our dollars. So you want a solution to the healthcare insurance affordability crisis, give the money to the people and let the insurance companies compete for our dollars, not for contracts.
Dr. Waldman, this is really fascinating information and it's a wealth of information. Can you let us know where people could go because you have a website and give us the full title of your book once again?
Sure. If you like English, become an empowered patient. You can get it at Amazon, Barnes and Noble, Books a Lot, whatever, all those stores. The website is, strangely enough, empowerpatients.info, not .com. This is not a commercial operation. I'm not trying to make money. I'm trying to spread an idea. And if you like Spanish, Say un paciente empoderado is available also on Amazon and other places. I did that very intentionally, I have to say, because we have millions of Americans who, while they may speak English, are more comfortable in Spanish. I don't want them disenfranchised. So that's why this book is in both English and Spanish.
Again, like I said, this has been a wealth of very, very good information. And I just want to add and ask you this sounds like more than book. I think you call maybe it's a toolkit, it's a guide to help people. So it's not a story book, right?
This is
This
a
is
campaign that we're under. We're trying to help people. We're not trying to fix the system. We're trying to help people learn why the system doesn't work and to take charge so they fix the system, not me and not Washington.
you said that word, Washington. I have to cough.
Yeah, it's that reaction is the same way when somebody says, and it's hard for me to say it without throwing up, HIPAA Doctors and nurses then turn and spit. Okay? Another great regulation that got in the way of our ability to take care of patients. This confidentiality thing literally prevents me from sending an email to a referring doctor. Not allowed to do it.
Well, I think, like I said, not I think I know. There's just a wealth of information, and a lot of us just don't know. So I'm glad that we were able to really dive into this. I know it's probably just scratching the surface, but I think you put a good crease right in there for us to understand
I do appreciate it.
what we need to
Become
do.
an Empowered Patient is not a book. It is a war cry in asking people to become an empowered patient, because that's how you'll get what you need when you need it.
Fantastic. Dr. Waldman, thank you very much for spending the time with us today. Just
My pleasure.